Hello and welcome back to my channel. Today we are going to take a look at the first coronavirus hospital in China. The hospital opens after workers and volunteers spend 2 days converting an empty building into a 1,000-bed medical center, as the global death toll hits 133. The outbreak began in Wuhan, home to around 11 million people. Hospitals in the city have been flooded with concerned residents and pharmacies are running out of medicine. The new hospital is expected to relieve some of the pressure on doctors and nurses in Hubei province, the epicenter of the outbreak, where overwhelmed hospitals were running out of beds, masks and other supplies as they were inundated with patients. The first batch of coronavirus patients were transferred to the Dabei Mountain Regional Medical Center in Huanggang at around 10:30 p.m. local time on Tuesday. 2 pop-up hospitals are currently being built from scratch to treat patients with the SARS-like virus. Hundreds of workers are racing to build a second hospital, called Huashanshan or Fire God Mountain Hospital, from scratch, which covers 6 acres in suburban Wuhan, in less than 2 weeks, with the first patients expected to arrive on February 3rd. A third hospital called Shanshan, or the Thunder God Mountain Hospital, also located in Wuhan, the city of 11 million where the flu-like virus is believed to have spread to humans, at a live wild animal market also being built from scratch, is due to open on February 5th, and there are plans for a 4th. Let's talk about how is China able to build a hospital in 6 days. China has a record of getting things done fast even for monumental projects like this, says Yan Zhonghuang, a senior fellow for global health at the Council on Foreign Relations. He points out that the hospital in Beijing in 2003 was built in 7 days, so the construction team is probably attempting to beat that record. Just like the hospital in Beijing, the Wuhan center will be made out of prefabricated buildings. This authoritarian country relies on this top-down mobilization approach. They can overcome bureaucratic nature and financial constraints and are able to mobilize all of the resources. Mr. Huang said that engineers would be brought in from across the country in order to complete construction in time. The engineering work is what China is good at. They have records of building skyscrapers at speed. This is very hard for Westerners to imagine. It can be done, he added. In terms of medical supplies, Wuhan can either take supplies from other hospitals or can easily order them from factories. On Friday, the Global Times confirmed 150 medical personnel from the People's Liberation Army had arrived in Wuhan. However, it did not confirm if they would be working in the new hospital once it has been built. Like other respiratory infections, coronavirus is spread by droplets from coughs and sneezes, with an incubation time between 1 and 14 days. There are signs it may spread before symptoms show. How does the virus spread? The illness can spread between people just through coughs and sneezes, making it an extremely contagious infection. And it may also spread even before someone has symptoms. It is believed to travel in the saliva and even through water in the eyes, therefore close contact, kissing, and sharing cutlery or utensils are all risky. Originally, people were thought to be catching it from a live animal market in Wuhan city, but cases soon began to emerge in people who had never been there, which forced medics to realize it was spreading from person to person. There is now evidence that it can spread third-hand, to someone from a person who caught it from another person. What does the virus do to you? What are the symptoms? Once someone has caught the virus, it may take between 2 and 14 days for them to show any symptoms, but they may still be contagious during this time. If and when they do become ill, typical signs include a runny nose, a cough, sore throat and a fever, high temperature. The vast majority of patients, at least 97%, based on available data, will recover from these without any issues or medical help. In a small group of patients, who seem mainly to be the elderly or those with long-term illnesses, it can lead to pneumonia. Pneumonia is an infection in which the insides of the lungs swell up and fill with fluid. It makes it increasingly difficult to breathe and, if left untreated, can be fatal and suffocate people.